this is Jessica DaMassa with WTF Health. I am here at Webbit in Sofia, Bulgaria. And joining me right now, I have Laurence Collins. He is a future of work strategist. And we were in a lovely conversation about the future of work as it relates to healthcare, specifically utilizing the digital disruption to improve productivity. So unpack this for me. Why, first of all, do we need to improve productivity in healthcare? And can digital technology really help us, and how?
Yeah, well, hi, Jessica. Absolutely. So I think digital disruption is going to not just impact medical, clinical services, but also the way we work. So I think in terms of connections, collaboration, innovation, just being more efficient in the way that nurses and doctors work together, digital has a massive role to play.
Why isn't this happening already? I mean, things are woefully behind. We joke around in the States all the time that people are still faxing things. So, I mean, why hasn't this taken hold? Why haven't we really integrated technology into healthcare well?
Yeah, no, you're absolutely right. Again, in our market, for example, in the UK, predominantly where we are, pages are still one of the most pervasive devices for communication. I think what it is, we're seeing that technology adoption is a lot slower than what we would expect in our normal personal lives, where we've got all types of virtual assistant and cognitive tools. Organisations just tend to be a little bit more risk averse around these things, and obviously investment is an issue as well. So what we do here at Rialto is connect healthcare workers in hospitals and across trusts, very much based on a business case. So how much is it actually going to make a difference to the funding and economics of a hospital trust? And at that point, we can try and accelerate the adoption of some of these technologies.
Okay, so you've mentioned Rialto, and for those who don't know, explain what it is very quickly.
Yeah, Rialto is a digital platform for connecting healthcare workers across the globe, really allowing them to share ideas, communicate, work in groups, but also organise the way they work and how they work. So really trying to bring the whole concept of future of work and different ways of organising teams to the workplace of healthcare.
Now, we had talked earlier, and you had said you've consulted outside of healthcare about the future of work. I mean, and within healthcare, it's just so challenging. I mean, there's a lot of organizations that are, kind of stuck in their old way of thinking. What do you think needs to change to really, I guess, tip the scale and revolutionize the way people in healthcare are working?
One word: leadership. For me, it starts right at the top. It's about the vision of the organisation that you're going to need to be. It's about the way in which you take people on that journey with you. But you need to understand how the technology actually plays a role in shaping that future organisation. And without those leadership skills, I think it's going to be very difficult for people to take advantage of the benefits that digital bring.
What can someone who is in a leadership role do in order to do that, in order to truly understand how to bring digital technology in a way that helps improve the productivity of their workforce?
I think two main things. Firstly, you need to go and connect with what's out there. So seeing the art of the possible. And then you need to bring that back and collaborate with your fellow leaders and with your unit leaders to understand how would we apply this to us. And then I guess you've got to build on from that commitment into having the courage to do it. Rather than talk about it. And that is, I think, the big leap that a lot of organisations with their leadership teams are trying to make. So in my world, I see an awful lot of investment dollars going into leadership programs specifically about operating in a digital world.
Okay. And I mean, as far as everybody else, because so many people, healthcare around the world is just huge in terms of a job category. So I mean, as far as those who are working on the front lines of care, even involved in the back end processes of a hospital or in an insurance company, how can those people contribute in the day to day to kind of advancing a new way of working that's a little bit more progressive or a little bit more technologically enabled?
So in Rialto, for example, in the hospitals that we're working in, we're finding nurses are beginning to form their own groups. And they're beginning to talk about improvements they can make in their own wards. So it might be wanting to change the way in which some of the layout of the ward is structured. It might be wanting to share information on shifts that they're going to be booking so that they optimise their availability for the good of the ward. So just allowing people to connect and then allowing them to have the content with which they can share and discuss their work challenges, we find people take control of their own working environment. And digital is the platform or the technology that enables us to do that. At the moment, a lot of it is still paper-based. There are people who are reliant on emails. They're having to go and find computer terminals to log on to intranets. The world's moved on, and I think digital is going to accelerate the way people experiment and enjoy new working practices.
So how much of this do you think really involves autonomy? I mean, not only in terms of the agency of the person who's working there, but also being able to work in a system, a digital system that is autonomous from the rest of, I guess, what a hospital has to offer, where things need to be protected.
Yeah, so I think what we're seeing as well is organisations are recognising the value of individuals thinking about what's good for them outside of just the workplace. So providing additional services, providing connections to entities that enable or enrich the quality of life of your worker. So they're not just your responsibility for the hours they're in your building. You're thinking about their welfare, their well-being, especially in things that are so stressful as some of the healthcare roles. We're seeing investment in occupational health, in well-being, sleep, how to help people with access to the kind of tools and resources that allow them to be more resilient. Now, that's not typically something you would say is a direct employer responsibility, but through a digital app, such as what we're doing with Rialto, we're pushing that content to the nurses in particular to help them become more resilient with the stresses and strains that they find in their everyday job. That's technology creating an impact in my individual life as well as just my work life.
Last question for you. We like to ask people here with WTF Health, what's the future? I mean, as far as paint me a picture, 3, 5, 10 years down the line here, what does the future of work look like in healthcare if everything goes well?
I can give you a view, and I'm seeing it play out in other industries, and there's no reason why healthcare is immune from disruption that others are facing, and that is we're going to modularize work. We're going to pixelate tasks down to a level where we can think more creatively about how those tasks are best fulfilled. So the big constructs of big shift patterns, big rosters, lots of sort of organized planning in advance is going to become much more real time. We're going to see much more agility in the way that work is broken down and the options that we have for delivering that work.
You make that sound so exciting. It's like, okay, I can't wait to go and work in that future. Lawrence, thank you so much for joining us.
Jessica.
It's a pleasure to speak with you. I'm Jessica DaMassa with WTF Health here at Webbit. Thanks so much for joining us.